Everyone experiences difficulty hearing sometimes, especially in the presence of background noise. In this video, we'd like to give you some good communication strategies to use when you find yourself in a difficult listening environment. First, some tips for the listener. Always face the speaker in good light. Don't bluff. If you miss something, ask for clarification. Lastly, watch for expressions and gestures when possible. And now, some tips for the speaker. First, gain the listener's attention before speaking to them. Always face the listener when speaking to them. Rephrase a sentence rather than repeat. Lastly, minimize background noise, such as moving away from a noise source or continuing the conversation in another room. In light of COVID-19, we'd like to highlight some tips for hearing aid use and wearing masks. One way to minimize the challenges of wearing hearing aids with a mask is to use a mask extender. This helps to prevent the mask from getting tangled with your hearing aids, preventing them from falling off or getting lost. Some individuals with hearing loss may prefer that their speaker wear a see-through mask so that the listener may lip read or take note of the speaker's facial expressions.
Over the past year, telehealth services have become a popular option for patients to visit with their providers from the comfort of their own home. Audiologists use telehealth in a variety of ways to meet their patients' needs. This can include having consultations on hearing technology over the phone or programming hearing aids remotely with the help of an app on the patient's phone. Many telehealth services require having internet, newer hearing aids, and the phone application from the manufacturer of your hearing aids. Remote programming is secure, and your audiologist can provide guidance on setting up remote programming services if they are available at your clinic. Be sure to ask your provider if they offer telehealth appointments if you are interested.
Hi, my name is Laura Coco. I'm an audiologist and I'm in Tucson, Arizona. And I was asked to talk about telehealth, which is one of my favorite topics. I researched telehealth. My PhD dissertation was on the use of telehealth, teleaudiology, to connect two distant locations, a rural community and an urban community, to provide hearing aid services to a community that didn't have a local audiologist. I'm also a clinician in Tucson, and I use telehealth, teleaudiology almost every day, every time I'm in the clinic, because we're in COVID and we're trying to minimize the number of times a patient comes into the clinic. The most common way that I use teleaudiology is in an appointment that uses the least amount of equipment. So with diagnostics, it's more challenging because a patient who's at home doesn't have an audiometer with them. So usually when I have a telehealth appointment, it's to counsel a patient on how to use their hearing aid, how to take the battery in and out, how to clean it, and counseling on communication tips, things like that. Telehealth has been incredibly useful both for, as I mentioned at the beginning, patients in rural locations and in communities who don't have a local provider, but also in situations where a patient is too sick to leave their home, doesn't have transportation. There's just too many to count, such a number of different opportunities to use telehealth. Those are my thoughts. Thank you for listening.
For our patients wondering how to make their hearing health a priority, here's the first step. Look for a local audiologist. You can also check with your insurance to see if any hearing healthcare services are included, and if so, what audiologists are covered under your plan. Scheduling a hearing evaluation can help you to learn more about your hearing. An audiologist will evaluate your hearing and provide any recommendations on next steps.